Welcome to Podocyte Talk. In today's episode, we're covering 3 important studies that explore new findings in chronic kidney disease, cardiovascular risk, and long-term metabolic outcomes. These studies provide valuable insights into optimizing treatment strategies for patients with kidney disease, addressing the role of iron therapy, sodium glucose cotransporter 2 inhibitors, and simultaneous pancreas-kidney transplantation. We begin with a systematic review and meta-analysis that evaluated the effects of iron therapy on cardiovascular and kidney outcomes in chronic kidney disease. Iron deficiency is highly prevalent in both chronic kidney disease and heart failure, yet major guidelines offer conflicting recommendations on its use. This study analyzed 45 randomized trials comparing intravenous or oral iron to usual care or placebo in patients with chronic kidney disease. The results showed that iron therapy reduced the risk of heart failure hospitalization and cardiovascular death by 16%, with consistent benefits across both dialysis and non-dialysis patients. The reduction in heart failure hospitalizations was particularly notable, while the effect on cardiovascular death was less certain. Importantly, the study also found that serious adverse events were lower in those receiving iron, suggesting a favorable safety profile. These findings reinforce the potential benefits of iron therapy in managing cardiovascular risk in chronic kidney disease, though more trials are needed, particularly in non-dialysis patients, to refine treatment strategies. While iron therapy addresses a critical component of cardiovascular health in chronic kidney disease, another area of active research is the role of sodium glucose cotransporter 2 inhibitors, particularly in patients with multiple health conditions or frailty. This leads us to the EMPA-KIDNEY trial, which examined the safety and benefits of Empagliflozin in patients with chronic kidney disease who also had frailty, multiple illnesses, and were taking multiple medications. The trial included over 6,600 patients, randomized to receive Empagliflozin 10 milligrams daily or placebo, with a median follow-up of 2 years. The study aimed to assess whether Empagliflozin remained beneficial in patients at high risk of hospitalization, often a marker of frailty. The analysis found that the strongest predictors of hospitalization were poor mobility, diabetes, high levels of a heart failure-related hormone, and reduced kidney function. Despite these concerns, Empagliflozin was well tolerated across all patient groups, regardless of frailty or the number of medications taken. The results showed that Empagliflozin reduced the risk of kidney disease progression or cardiovascular death by 28% and lowered all-cause hospitalizations by 14%, with the greatest benefits seen in those at highest risk of hospitalization. These findings emphasize that even frail patients with multiple health conditions can experience significant protection from Empagliflozin, making it a valuable option in kidney disease management. As we consider long-term treatment options for kidney disease, some patients with type 1 diabetes and end-stage kidney disease may undergo simultaneous pancreas-kidney transplantation to restore normal blood sugar control and kidney function. However, the long-term metabolic impact of this procedure remains a key area of research. A study evaluating 500 patients who underwent simultaneous pancreas-kidney transplantation at a single center followed metabolic and kidney function outcomes for up to 10 years after transplantation. The findings showed excellent long-term patient and transplant survival, with 97% of patients surviving at 1 year, 92% at 5 years, and 87% at 10 years. The survival of the transplanted organs was similarly strong, with no major differences based on body weight. However, significant weight gain occurred post-transplant despite improvements in cholesterol levels and insulin sensitivity. Additionally, urinary protein levels initially decreased within 3 years, but then rose significantly between years 3 and 10, raising concerns about long-term kidney health despite stable kidney filtration levels. These findings highlight the success of pancreas-kidney transplantation in achieving long-term survival and metabolic benefits, while also underscoring the need for careful post-transplant monitoring to manage cardiovascular risks and kidney function. Thank you for tuning in to Podocyte Talk. Stay connected for more discussions on the latest advancements in kidney disease research and clinical practice.